Doctors, over 1,000 of them adding their voices against the assisted dying bill.
This current bill is simply not safe. There are inadequate safeguards against coercion. We know that a very small number of coercion cases eventually go through to prosecution. It's very hard to spot.
Do you not believe that this legislation has more safeguards than any piece of legislation before it? Do you simply not accept that?
Surely the question here is, are the safeguards good enough? And you have in front of you a letter from over 1,000 doctors that have said the safeguards aren't enough.
In a letter sent to MPs, they say, as experienced medical professionals who regularly work with dying patients and who have reviewed the worldwide evidence on assisted dying, it is our opinion that this bill poses a real threat to both patients and the medical workforce, and we urge you to vote against it. But Dr. David Nicol is a medical professional who has worked with dying patients, and he disagrees with his clinical colleagues.
Doctors are actually no different than the public in that there are a wide range of opinions on this. There are 395,000 doctors in the UK, so the fact that 1,000 doctors disagree with assisted dying, and probably always will, actually should not be a surprise.
So the medical community, like wider society, remains divided. But ultimately, neither will decide. Yes, they can influence their MPs, but when the bill returns to Parliament, it will be up to the politicians who will have their say on whether or not to introduce the biggest social change to this country that many of us will ever see in our lifetimes. And some MPs are already reconsidering their position.
I abstained on the first time round. I decided I wasn't going to vote because I wanted to hear the debate. Of course, I don't want anybody to feel that they're a burden on society and feel that that should lead them towards taking their own life. But I also have heard the cries of people who are absolutely miserable, and that's why I will be voting for the bill.
Daniel Francis has a daughter who has cerebral palsy, and he's worried about safeguards.
I support the principle of assisted dying, but I don't believe this bill, as it is fit for purpose. I'm the parent of a child who has very complex disabilities, including a learning disability, and I believe that the Mental Capacity Act was not written for this scenario.
But your daughter would be safeguarded against assisted dying.
My daughter would be safeguarded simply because of the level of mental capacity she has. The principles of the Mental Capacity Act, I believe, will lead to scenarios where somebody with a learning disability will go through this process without their family member being aware, and could well be assisted by the doctor to make this decision.
This debate will rage on for the next 2 weeks and beyond. Rightly so. This is literally a decision about life and death. Ashish, Joshi, Sky News.